PureGraft, it's a really interesting, not new technology, but one that is really up and coming. I think a lot of people are finding out about and using it. Caroline, tell us a little bit about PureGraft and how you're using it clinically.
Right, so for fat grafting for me, I primarily do breast, a lot of breast. So in my revision cases or in reconstruction cases, lumpectomy defects, radiation defects, more smaller volumes is what I needed for years. And the PureGraft system basically is a system where you harvest your fat and it's a washing system. It washes, you can order certain size bags, you wash it. While I'm busy harvesting and closing, my staff is already working on washing it. And then by the time I'm pretty much finished with the harvesting, repositioning the patient, they have the syringes loaded already for me that have been washed and cleaned and ready to go.
Kristi, one of the things we have issues with is losing fat. You know, particularly people don't have a lot of donor sites. Maybe you can talk a little bit about that.
No, I mean, there's no question when you look at PureGraft fat, it's beautiful. It's like this beautiful golden color. That's a visual thing. But there's some great histologic data as well that you can really see with that minimal manipulation, washing out those impurities. That fat histologically is great too. And especially when you want every ounce of fat that you can to survive in certain donor areas, like you're saying, when you have your skinny gals that don't have a lot of donor sites, you want every ounce of that to take as much as possible. So having that small micron, that 74 microns is fantastic. It doesn't disrupt those adipocytes, those fat cells. It's beautiful fat and really has shown to take much better as well.
Renee, closed system, I think this is a closed system. Maybe you can speak to the advantage of that.
This is such a hot topic right now. I mean, we're getting surveys in our membership, in our societies, asking us if we're putting antibiotics in our fat because we're so concerned about cysts, infections, things, all the complications we see with fat grafting in the past when it would just be poured out in the open over a strainer or rolled out in Telfo with the fat sitting to the air. So this is a closed system, which is, it's giving us the comfort that this is about as sterile as we can possibly provide to our patient. And I think everything we do in plastic surgery is about sterility. And, you have clean fat, you have sterile fat, you have the highest chance of success that this is going to take.
I love too that they have some big bags. I know that you do a lot of breasts, but I do a lot of buttocks grafting, and so I need larger volumes. And so I think it's been fantastic that this is a system that allows me to do some high volume grafting, because it's not unusual that you're putting 600, 700, 800 cc's in a buttocks. Right. And so at least we have options now where we get that beautiful fat in bigger systems.
What's the single thing that really resonates with you in terms of this technology?
I think one of the most important things is just getting, again, longevity. I know we talked about this in the breast and even in the buttock, but particularly in the face too. And a lot of us are using different size fat, whether it's this milli, micro, nano fat, and we're using that in different parts of the face. And I know I do that with a lot of my facelift, and it's really important that as much as we tell patients it's variable, what can last is that we really try to get as symmetric of a result and lasting result. I think your first shot is your best shot. So having, again, the best quality fat is going to make the biggest difference.
The other thing too that is very important for me, now I work in a surgery center that I don't always have the exact same circulator and the same person in the room, and it's basically having some sort of video content, some sort of an education for the staff in the room that day. They really have to understand a system that is not that complicated. They're not doing a lot of additives, they don't have to soak it in some type of gauze and things like that. I walk into the room and they actually have pictures pasted up on the wall step by step that they took right off of the website from the company, and I know they're making new materials. If you have your own OR and you have your same team every day, it's easy. But for those of us who happen to go to hospital situations or surgery centers, you want a system that they can set up and do like I said, while I'm closing, that fat is getting produced and it's all sitting there nice, that yellow, nice fat you were talking about.
No. I think it is easy to use. It's not, adding 15 minutes to process it. Actually, it's much quicker than some of our old techniques. And to your point, predictable results.
And last thing, Caroline, how do you think it fits into the landscape of cost, for aesthetic patients?
Yeah, it's priced reasonably. It is part of our revision cases. It's what we use in the breast. So I think reimbursement from the insurance side is a little bit of a battle always. From the cosmetic side, it's fast, it's in the OR, and it lasts. And that's what they want. If they have precious fat, you want to put it where it's going to last.
All right, well, that's great stuff. Just to summarize, I think it's easy, it's efficient, it's science-based, it's exciting technology. and we'll look forward to further things that you all are looking at and researching. So thank you.